be right beside your.
Yeah, it's recording now.
Okay, perfect.
All right. So I want to ask you, all the attendees, that what do you know about oral hygiene? What do you think what oral hygiene is? Anyone?
I'm going to say keeping your mouth and your teeth clean.
Well, yeah, that's the right thing, Alison. Thank you. So oral hygiene is practice of keeping your mouth clean. And how you do it? It's simple. You do regular brushing of your teeth by using toothpaste and a brush, and you clean between the teeth with the help of a floss. So why oral health is important in seniors? The thing is, oral health directly affects the overall health. And if the overall health is affected, the quality of life is compromised. So it's all interconnected. If you have bad oral health, it can have various systemic problems. We have someone joining. All right. So just to give you an overview of what all kind of systemic diseases can occur due to poor oral health, well, you can have heart diseases. You can have infection of sinus. If you have prosthetic joint, you can have infection of that. You can have even problems with the nerves, like trigeminal neuralgia. You can have brain abscess, meningitis, which is the infection of the outer layer of brain. You can have lung abscess, and even you can have inflammatory bowel disease, which is the disease of the digestive system. And many people ask me, how come poor oral health can affect various organ systems? And the answer to this question is very simple. Why? Because the oral cavity is having a lot of blood vessels. And when your oral health is compromised, the germs like bacteria and viruses, they enter into the blood vessels, which are like highways and motorways, and then they can travel anywhere in your body and can start a potentially dangerous infection. So why seniors' oral health is important from dental point of view? Now, usually when people cross the age of 60, they have some kind of chronic disease. And by chronic disease, I mean diseases that last for a very long time, not like seasonal flu that gets over in like a week or two. Chronic disease lasts for years and years. And because of that, people take medication for a prolonged period of time. So because of the chronic disease and the medication, there is an increased risk for oral and dental problems. And when you have oral and dental problems, and I said before, when your oral health is compromised, you can have systemic disease, or a systemic disease that you already have may aggravate. Like if you have poor oral health and if you are diabetic also, then your diabetes will be more increased. That means your sugar level in blood will be more. So in this presentation, I will be talking about three potentially dangerous problems. Okay, we have another attendee. All right. So we have, in this presentation, I will be talking about three important problems that occur in seniors. First is dry mouth. Second is oral cancer. And third is gum diseases. And these three problems are the most dangerous in seniors that has been seen. So what is dry mouth? Dry mouth is also known as xerostomia. It's a medical terminology. So can anyone tell me what do they understand when I say dry mouth? Anyone?
Not enough saliva?
Yeah, that's the thing. Yeah. So dry mouth means it's a decreased secretion or not having saliva in the mouth. And it's a very common condition in people above the age of 60. So what are the causes of dry mouth? So the first and the most important cause is the side effects of certain medication. American Dental Association has pointed out 400 medications that can cause dry mouth. I have listed only 3 because these 3 are commonly taken, like high blood pressure medication, antidepressant, anti-allergic. Then secondly, aging. As you age, your salivary glands tend to produce less saliva. That's another factor. And lastly is radiation therapy for cancer. So if a person had cancer and they underwent radiation therapy, so the radiation can, to some extent, damage the salivary glands, and hence the salivary secretion is compromised. So I'm talking about dry mouth and no saliva, but why saliva is important? Why do we need saliva? Well, saliva is having a lot of benefits. Firstly, saliva prevents tooth decay by neutralizing acid production by bacteria in your mouth. What I mean by this is when you do not brush your teeth properly, when you have poor oral hygiene, so the bacteria in your mouth, they eat up the food particles that are present on your teeth surface or maybe between the teeth. And then they produce a byproduct, which is acid. Now, this acid can lead to tooth decay. Saliva helps to neutralize this acid. Then saliva acts as a natural cleanser. That is, it rinses off food particles from the tooth surface or between the teeth. So it's like it just cleans off your mouth naturally. So if you have no food particles, bacteria won't be able to act on anything. No acid will be produced, and there will be no teeth decay. Then saliva is also having enzymes, and these enzymes helps in digestion. And I don't know if you know, but the digestion process starts from the mouth, not in the stomach. So if you're missing saliva, you will be missing these enzymes, and hence there will be problems like constipation. Also, saliva helps to maintain your ability to taste. The food you taste, it's because of saliva. Then saliva is also having the property to rebuild the wear of outer layer of teeth. Now, the outer layer of teeth, which is called enamel, protects your teeth from acid attacks from food or from bacteria. But it is sometimes weared off. So the saliva is having minerals like calcium and phosphorus. It helps to rebuild this layer, and the process is called remineralization. So in this presentation, I will only be talking about how we can prevent the conditions that I will be talking about rather than treatment. And prevention is always better than treatment. So how you can prevent dry mouth? First of all, do not take unnecessary medication, over-the-counter medication. So if you have headache, if you have pain, do not try to take aspirin or some painkiller. Ask your physician. Maybe there can be other alternatives. A good sleep can help you relieve headache. Secondly, improve your lifestyle to limit the intake of the prescribed medication. So for example, if you have high blood pressure, try to exercise, have a healthy diet, healthy routine. So in this way, the high blood pressure will come to a normal range. So when you will visit your physician, the physician will say that, you know what, your blood pressure parameters have come normal, and I'm going to reduce your medication, and hence the chances to have dry mouth will be reduced. Thirdly, drink water. Always be hydrated because 90% of saliva is made up of water. Limit caffeine intake. Caffeine leads to less production of saliva, and stop tobacco. I'm not saying limit tobacco, just stop tobacco. So lack of saliva can cause many things. And one of the dangerous things is it increases plaque production. Now, plaque is a viscous kind of layer that is always present on your teeth surface, which comprises of food particles, some amount of saliva, and it contains a lot of bacteria. And these bacteria can lead to tooth decay, later on cavities in the teeth. And these bacteria are also responsible for gum disease. So plaque is like a house to bacteria. Mouth sores can happen. Yeast infection like oral candidiasis can happen. It's very painful. Split skin at the corner of your mouth, cracked lips, again, painful. And if you have cracked lips, it's anesthetic. And lastly, poor nutrition from problems with chewing and swallowing. So when you are having dry mouth, you will have problems when it comes to chewing. Secondly, you won't be able to taste food. That will lead to poor nutrition. So now it becomes important for people to know the symptoms of dry mouth so that they can be prudent. They know, okay, maybe this is dry mouth, and they can visit their dentist or physician. So you can have the feeling of stickiness in your mouth when you speak or chew. You can have bad breath. You can have hoarseness of voice. You can have a grooved tongue. And in this picture, you can see the right picture shows the normal tongue. However, in the left picture, you can see how a tongue in a dry mouth looks. It's pinkish, it's shiny, and it is grooved. Then there will be change in the sense of taste. And those of you who are wearing dentures, they will see that the dentures just come out when they're speaking or chewing, especially the upper denture. Now, second, I will be talking about oral cancer, but before that, if anyone is having questions related to dry mouth, you can speak up. If no, I will continue. Okay, so I'll continue. So oral cancer, seniors are at a very high risk to develop oral cancer. And 2/3 of people who are diagnosed with oral cancer are usually over the age of 55. So these are the areas where oral cancer can develop, and these are the only areas. Tongue, inner lining of cheek, and you can see the purple arrow. This is what inner lining of cheek is. Roof of the mouth, floor of the mouth that is beneath the tongue, gums that surrounds your teeth, and lips. Now, the biggest challenge with oral cancer is late diagnosis. By this, I mean most oral cancer lesions are painless during their initial stages with no significant symptoms. And when there is no pain, no symptoms, no one goes and see a dentist. They think, okay, it's normal. However, in advanced stages, what happens, there is pain, there is associated symptoms. However, at this time, it's quite late. When people approach the dentist or a physician, this disease or this oral cancer can be fatal or may lead to severe disability. That means they may cure your oral cancer. How? If you are having cancer of tongue, they will just take out your tongue. And that's a disability. I am not scaring you, but I'm just telling you that these are the things that can happen if the diagnosis is late. And that's why it becomes important to know the symptoms so that you initially know that, yes, these are the symptoms of oral cancer and I should visit a dentist or a physician. And the symptoms that you can see are a sore that does not heal. It can be in your mouth or it can be in your lip. It won't be painful, but it will never heal. It will be having a white color or a red color, and sometimes it is a mixture of both white and red color. Besides sore, you can also see a growth or lump. You can feel that. Again, it will be white or red in color or a mixture of both. Then if you're having cancer of gums, so the associated teeth, they will become mobile. If you're having cancer of cheeks, there will be ear pain. If you're having cancer of tongue, you will have difficulty, and later on you will have painful swallowing. So these are the symptoms that you should know. So this diagram, this picture shows the cancer of the base of tongue, and you can see it looks white in color. And people usually think that this might be something that they ate, some food, and it has stick to the tongue, and they try to take it out with the help of tongue cleaner, but it will never come out. It will be there always, and it won't be painful. So people think, okay, it's nothing to worry about. It's not causing me pain. It's just a white thing. But no, it's a cancer, which is at its initial stage. This is a cancer of lip. It looks painful, but it is not painful. It will not ooze out blood, but it is potentially a dangerous thing. So what are the risk factors that put a person to develop oral cancer? Tobacco, any kind of tobacco, smoke, chewable, snuff, they can put you at risk of having oral cancer. Excessive alcohol use. Now, if you're a heavy drinker, it doesn't mean that you will develop oral cancer. But if a person is heavy drinker plus smokes tobacco or whatever used tobacco, then both the things combined can put you at a very high risk to develop oral cancer. Excessive sun exposure to your lips. UV radiation are harmful, and excessive exposure to these radiation can cause cancer of lips. A weak immune system. Now, this is a fact that with age, immunity decreases. And if your immunity decreases, it's compromised, plus you're a heavy drinker, you use tobacco, you're at a very, very high risk to develop oral cancer. Other things like malnutrition, lack of sleep, anxiety, and depression also reduces your immune system. So all these things are connected. If you are having any of 2 or 3 things, these risk factors, you are at a high risk to develop oral cancer. Lastly is human papillomavirus. It's sexually transmitted. Although it is very less commonly seen in people above the age of 60, but it's worth mentioning because it can cause oral cancer. So how you can prevent oral cancer? It's very simple. Just be away from all these risk factors. Stop tobacco use. Alcohol intake should be moderate. Avoid excessive sun exposure to the lips. So if you're going out, you should check whether what's the UV index. Higher the UV index, try not to go outside. If you cannot avoid going outside, try to use lip sunscreen, use a broad brimmed hat. And usually when I tell broad brimmed hat, some of my patients, men, they used to tell me, no, we cannot wear hat. Well, it's not about fashion, it's about saving yourself from the harmful UV radiation when the sun is high and the UV radiation is high. And lastly, you need to visit your dentist regularly. Now, early cancerous lesions can be detected and hampered from progression. So it's essential that you visit your dentist at least once or twice a year, so that if you have any cancerous lesion, it can be detected early. So any questions regarding oral cancer? Well, I'm not hearing a lot of questions, so probably I will be asking questions at the end. So coming to gum diseases. Now, this is common and potentially severe condition that can occur in seniors. And there are 2 types of gum diseases, gingivitis and periodontitis. Now, what gingivitis and periodontitis means? So the infection of gums is called gingivitis. So the gums actually surrounds the teeth, and infection of that is called gingivitis. Beneath the gums, you have the bone. The teeth are anchored to the bone, and infection of the bone is periodontitis. So it is important to know how gum diseases occur. So usually, what happens is when you have poor oral health, you do not brush your teeth properly, there is plaque buildup. As I told you, plaque, which is having a lot of bacteria, having food particles. And plaque is essentially built up at the gum line, as you can see in the diagram. And the bacteria from here, they start to infect the gums. After time, that means after a month or maybe 2 months, this plaque is not cleaned, converts into tartar, that in medical terminology we call as calculus. And tartar is quite hard, and now this tartar cannot be removed by normal brushing or flossing. Now, tartar contains more dangerous bacteria as compared to plaque, and more abundant bacteria. And then what happens, the gums start to swell up. They will not be painful, but you will see that when you brush your teeth, there may be bleeding. And finally, this infection will invade the underlying bone, causing destruction of both the gums and bone, and there will be teeth loss. Now, in this diagram, it depicts how gum diseases starts. So the first picture shows a happy tooth. You can see where gum lining is. The gum is the pink thing. The bone is the yellow thing with brown granules. Now in the second picture, the plaque has built up this brown thing with spiky little bacteria, and the gum has slightly detached from the tooth because it has been infected. In the third picture, you can see that the plaque has been now converted into tartar, and the gums have detached more. The bone has been infected and it has receded. And at the fourth picture, you can see that the gums are swollen up. They are completely detached from the tooth. Bone has receded completely. And finally, the tooth loss occurs. So what are the symptoms of gum disease? Now here, it is essential to point out that approximately 20% of individuals have undiagnosed gum disease. And it's same like oral cancer, because during the initial stages of gum disease, you will have no pain, no associated symptoms. So the classical symptoms are, so at the beginning, you will see your gums are swollen, they are red, but not painful. Later on, you will see when you brush your teeth, there is bleeding. After a few weeks, you will see that the gums are receding. You can see the root of your teeth. Your teeth will become sensitive to hot and cold fluids, hot and cold food. You will have bad breath. You will also have pain when chewing, and at the later stage, the teeth will be mobile. So these are classical symptoms. And if you have these symptoms, you should, as soon as possible, visit your dentist. So why gum disease is dangerous for seniors? Okay, you are losing a tooth or teeth. Why is it dangerous? Well, as I said, if you have poor oral health, you have gum infection. Gum infection leads to gum recession, bone loss, and toothless loss. But after this, the real thing starts. When tooth is lost, and as I mentioned previously, the blood vessels are exposed. So the infection that started the gum disease now enter these blood vessels and can now travel to any part of the body. And seniors have a comparatively weak immune system, and they have some kind of chronic disease or diseases. And this infection now can aggravate the already present diseases, or it can start a new disease. For example, as I said, if you are diabetic, gum disease will worsen your diabetic condition. So how you can prevent gum disease? Proper brushing technique. You need to brush at 45-degree angle to gums in short circular motion so that the toothpaste can dissolve all the plaque, which is responsible for gum disease. So this is what I mean by 45-degree angle. The bristles are at 45-degree angle. So you just need to tilt your brush a little, and that's what 45-degree angle means. So you can see the picture one, and the small picture one shows how what 45-degree angle means. The picture 3 and picture 4, they are important. Why? Because people usually neglect the surface facing the tongue. These surfaces also need to be cleaned. So you need to clean every surface, not only the surface that you can see. Secondly, you should go for dental prophylaxis at least once or twice a year. And dental prophylaxis is an oral checkup where dentists and dental hygienists will do some procedures to prevent oral diseases. So they may take x-rays if required. They will assess your gum health. They will do scaling, which is removal of plaque and tartar. And they will take your past medical and dental history, will assess them, and will update them. And people are quite afraid when they hear about dental prophylaxis. They're saying it's kind of a surgery, dental surgery. It's not surgery. It's essentially cleaning your mouth. So the procedures in dental prophylaxis are scaling, where the dental hygienist will use an ultrasonic scaler that vibrates quite fast and will break down all the tartar. They may also use hand scaler, which are not electronic scalers, and will remove any plaque or tartar between the teeth. After scaling, they will go for polishing to remove stains like tea stain, coffee stain, tobacco stain. So they'll use a special paste. They will put the paste on the surface of your teeth. They will use this rubber cup. You can see the picture. And this rubber cup rotates and will clean the surface of your teeth and will get rid of any stain. And lastly, they will do this interdental flossing. It's normal flossing. They will remove food debris and plaque that you are not able to remove. And that's how dental prophylaxis works. It cleans your mouth. So this is, I want to show, this is a small video, and this is what ultrasonic scaler is. It vibrates, it breaks off this hard calculus, and the water then rinse off this calculus. This is how it works. It's nothing dangerous. Now, finally, what is the recommended oral care for seniors to maintain their oral health and improve their oral health? And it's not a rocket science. It's simple. First, you need to brush your teeth twice a day. If you find difficult to use manual toothbrush, and I've heard from many seniors that they have problem with manual toothbrush because it requires strength. Some people who are having disability, they also find difficult to use manual toothbrush. So then you can switch to electric round bristles toothbrush. So it's electric. It rotates, so it cleans by itself. You don't have to put on strength. Then floss your teeth daily, essentially before going to bed. Remove the plaque or food debris between the teeth. You need to use sewing motion. What can happen during flossing is your gums can bleed. And two things can be responsible for bleeding of gums. First, which is commonly seen, is that you're not using the floss properly and hence you're hurting your gums. Secondly, your gums are infected, they're inflamed, and that's why there is bleeding. In both the cases, whatever the case is, you need to visit your dentist. Now, the string floss is the most common type of floss that is used, but most of the people find it difficult to use because you need a technique to clean your teeth with this floss. So nowadays in market, plackers are very common. It comes with this plastic handle and this little string of floss, and it's easy to use. It can be maneuvered easily, so people nowadays go for this. The alternative to traditional flossing, the thread flossing, is water flosser, or the short name is water pick. It's a handheld device, and it sprays streams of water in steady pulses. Now, this stream of water, it's having the force, and it removes the food in between the teeth. I also use this thing. It's much better to use. It's not technique sensitive. You do not need hand dexterity like you need in traditional flossing. So this is a video that will show how a water flosser works. So you just have to put the tip at the gum line and just need to move it around the gum line, and the work will be done by the water. Water will force out any food particle or plaque in between the teeth. Third is clean your dentures every day. For all of those who are wearing dentures, you need to clean your dentures because dentures are like magnet to bacteria. So you need to remove and rinse your dentures after every meal. When you remove your dentures, you also have to clean your mouth. So what you can do is you can use a soft bristled toothbrush to clean your tongue. If you're using a partial denture, then you of course will be having few teeth. You need to clean those teeth also. Use a wet gauze to clean the area where there is no teeth, your roof of the mouth and cheeks, to get rid of any food particle or build up plaque. Very important is that you need to also remove any residual denture adhesive from denture, essentially from the grooves of the denture that fit against the gums, because denture adhesive try to just stick a lot of food particles, and it becomes kind of an epicenter for bacteria. Brush your dentures daily and use a soft bristled brush, and if possible, use a non-abrasive denture cleanser. Why soft bristled brush? Because dentures are brittle. They can break if you use hard bristled brush. And then soak your denture overnight. And by this, I mean, if you are sleeping, even if you're taking a nap, remove your dentures. Do not sleep the dentures on. And when you have removed your dentures, you need to take care of your dentures. You need to store your dentures carefully. So what you can do is you can put your dentures in water or maybe mild denture soaking solution. Nowadays, the dentures are being made with different kind of denture materials. So consult your dentist, ask them that what and how you can store your dentures. If people who are wearing dentures, whether partial or complete, and you see that your denture comes out when you're speaking or eating food, as soon as possible, visit your dentist. It's not a good sign. Now this thing, attention in that I've put in this red box. So this is like, unless your dentist recommend, do not use denture adhesives or powder for better retention. And why? It's because denture adhesives are carcinogenic. And if you use it for a prolonged period of time, it can cause oral cancer. So do not use unless your dentist recommends you. And even if your dentist will recommend you, they will only recommend you for like a week or two when they are making your new dentures. So do not use it unless advised. Get dentures if you have missing teeth. It's important because if you do not get dentures and the bone where there is no teeth, it will recede and recede if you do not get dentures. Another alternative to dentures is a dental implant, but it's only possible to get dental implant if you have strong bone, gums, and you have few missing teeth. The benefit of dental implant is that it remains for lifelong, that a better durability. It doesn't have to be taken care of like we take care of dentures. As I said, and I previously mentioned, say no to smoking or use of tobacco, any form of tobacco. And visit your dentist twice a year so that if you have any kind of precancerous oral lesion or any gum disease, it can be diagnosed early and can be stopped at an early stage. Diet becomes quite important when it comes to oral health. And many people do not see diet as an important topic when talking about oral health. So diet is also not a big thing. You just have to drink optimal water, 2.5 liters every day. Fluoridated water is much better. And what I've heard that North Bay is having fluoridated water. Fluoride only makes your teeth stronger and more resistant to acid attack. Then you should have a balanced diet that must comprise of calcium, vitamin D, phosphorus. Again, these three things make your teeth more stronger and resistant to tooth decay and cavitation. For vitamin D, you need to go outside. So take walks, go outside. You need to eat citrus food like oranges, lemons, strawberries, raspberries, because deficiency of vitamin C can lead to a disease called scurvy. And it is seen commonly in seniors because when seniors lose their teeth, they tend to avoid fruits, and hence they can develop scurvy. Plus, decrease intake of any refined food high in sugars like chocolates, candies, potato chips, even the bottled juices. I heard one of my patients told me that I'm very healthy. I always drink juice. And I asked the patient, what kind of juice? So he showed me a bottle of juice that this is Tropicana juice. It's a real juice. No, it's artificial. It's having preservatives. Do not use that juice. If you want to drink juice, bring fresh fruits, use your blender and make juice. Lastly, eat hard fruits if you have teeth. Now, the benefit of eating hard fruit is that when you bite, this hard fruit passes between the teeth and removes any food debris or plaque. So it acts as a natural flosser. So you don't have to use a flosser if you're having hard fruits. But if you are missing teeth, you can cut the fruit in small pieces and then you can eat it. Now, at last, I want to say it's a myth that losing teeth is a part of getting older. It's a cliche. No, the reality is that not taking care of oral health and to some extent the general health will lead to loss of teeth. Loss of teeth will then lead to other consequences, other systemic consequences that I discussed previously. Thank you very much. And I want to say if a person cannot maintain his or her oral health, no dentist or oral surgeon can help them. You need to help yourself first, then only healthcare workers can help you. Thank you.
Thank you, Vipul.
Thank you, Allison. And if anyone is having any question, please, I'm very happy to answer.
I have a question. In general, what's better? Like if you have like full mobility, is an electric toothbrush still better, or is a regular toothbrush just fine?
Well, a regular toothbrush is always better. But if sometimes what happens, people do not know how to use the brush properly, the manual toothbrush. If you do not know, then yes, go for the electric toothbrush. But if you have full mobility, you have no problem, then the manual toothbrush is the best to remove plaque or any food debris.
Okay, perfect. And then I had a second question. Is it better to brush your teeth first thing in the morning before you eat or after you eat breakfast?
Well, that's a very nice question. And many people are confused about this thing. Okay, so I'll tell you. First eat your food and then brush your teeth. And you may ask why, okay? And the answer is, when you get up in the morning, you feel a kind of a taste in your mouth. I don't know if you feel it or not, but usually people feel it. Those are the enzymes, okay? You don't have to spit those enzymes. Drink water, eat food so that these enzymes go inside your stomach because they will help in better digestion, okay? And after you ate food, just brush your teeth to remove any food debris. Brushing is just to remove food debris, and morning brushing is very essential. Why? So that you do not produce bad breath Otherwise, your friends won't talk to you. Yeah.
Perfect. Thank you very much.
Thank you. No problem.
Well, it doesn't look like anybody else has a question, but if you do, you can email us here at NNPCN and we'll pass on the question to Vipul. We thank you, Vipul, very much for joining. This was a very informative presentation. It's not something that we hear a lot about, oral health. So that's excellent. And I think that's it for today.
Thank you, Alison, and thank you, everyone, for joining. And have a great day. Bye-bye.
Thank you. Bye.
Bye-bye.